COVID-19 has impacted each one of us in different ways. The only way to protect each other is by working together. Here's a few tips to prevent COVID-19. Wear a mask. Wash your hands frequently. When you cough, cover your mouth. Don't touch your eyes, nose, or mouth. Avoid contact with sick people. Clean and disinfect.
And this will help everybody get through COVID-19.
And let's protect Middle Georgia.
There may be a lot of things with which we are not familiar with in this country right now and around the world. But I guarantee you, everybody is familiar with COVID, with the coronavirus. And it's something that has modified and changed our whole life, our lives, and we are very, very worried about that. And there have been all kinds of approaches as it relates to trying to address it and treat it and get a vaccine for it and all of that stuff. And the interesting thing is that it affects African Americans and low-income people disproportionately. Thought I couldn't say that word, didn't you? But I did. And so I'm just so excited about a project that's getting ready to come to Central Georgia that's going to deal with one part of COVID. You know, part of the problem is, you know, we all wonder, do I have it? Do I not have it? And if you try and go get tested for it, you know, you get another gray hair before the test results come back. So, you know, when I heard about this project called Top Dog Solution COVID-19 Testing, you know, I became very excited. And I have with me today two young ladies who are going to bring the Top Dog Solutions to Central Georgia as it relates to testing, in the person of Dr. Anna Everett, PhD, and Dr. Paula Harmon, MD. And, you know, I'm going to introduce them and I'm going to let them in. I'm going to let them tell us a little bit about themselves. And we're going to get into this very exciting drive-by testing project. And matter of fact, look, unless you're going to get there at 2:00 in the morning, you're not going to beat me there. I want to be first in line. I want to be the first to try it out because I'm sure that we all need the satisfaction of knowing, you know, whether we have it or whether we don't have it. You know, we've had friends and relatives and colleagues and comrades and church members and children. And I can go on, you know, that we are wondering if they have it or we are knowledgeable that they have had it. So one way to curb it is to know whether or not you got it. We're going to begin with Dr. Everett got a story to tell as it relates what generated this project. Introduce yourself and tell us that story, Dr. Everett.
I'm Dr. Anna Everett, and my story with COVID is I got a fever one day, and I hadn't had a fever in about 40 years. And so I called Dr. Harmon and said, I got a fever. She said, girl, what you gonna do? So I was gonna go get tested. And so I left my home to go get a test at the CVS and was told that you had to go online and schedule an appointment. So I went on and tried to schedule an appointment quickly. And that began my journey at trying to get access to testing. So we went to the Department of Public Health site, my sister in Florida, my sister in Georgia. Everybody was looking for a place for me to get tested. I went to 5 different testing locations. I tried to pay $500 for a test. I tried to get a test shipped from China so I could get tested. And I got really upset and bothered because I thought about people who were less fortunate than I am, who don't have the same access that I now have. And I had been in a position in my life where I didn't have access to things, especially healthcare, you know, in my earlier years. And so here I am with all of these resources, all this access. I can go pay for a test. I have a car. I have physicians as friends. And we couldn't get me tested. None of it. And I became really frustrated. So me and Paula started talking. She called me one day and she said, Anna, let's open up a testing site. And I was like, run it. Let's do it. So I'm a social entrepreneur, and I have a company that I've had for about 15 years now, 20 years, consulting, and then just creating different business opportunities in our community. And so I'm known to be an executioner, and I get it done. And it's usually social entrepreneurial. So the community has to benefit in anything that I do, especially the faith community. In most cases, they are a benefactor of all of our initiatives. And so me and Paula started the planning process. I got my staff involved. We started to hire new people and bring them on and start the plan to implement where we saw that the greatest needs were in the state of Georgia. And so Georgia is like the number one in the nation now for COVID confirmed cases. And that's really sad, especially when we are disproportionately the individuals who end up with COVID. And so I had a fever for about 3 days. God was good to me in the process in the sense that I got through it. I lived through COVID. I successfully recovered from it. And so now, it's part of our mission and our goal to make sure that we help others get access. During this whole COVID journey, prior to becoming positive, I was collecting data. I was helping churches to write proposals to help to disseminate information and educate our community about COVID. And this was an outside to what I do in my daily life. We wrote some songs. We pushed out music videos for our youth to try to encourage them to stay in place. And with all the things that I did to stay in place, I still ended up with COVID. So I think it's really important to know. And it took me about 11 days to get tested and probably maybe 5 days to get my result. And then it took my children about 26 days to get tested after I got tested. And that's within exposure. So when I got exposed, I had the resources to have them leave my home and go with my mom and my family, my aunt, to take care of them, to not further expose them in case they weren't positive. But it was a rough isolation. But it was worth staying in place so I would not hurt or infect anybody else with the disease. So access is key. So part of this is Top Dog Solutions, and then we say access. SAE is Solutions AE and access. So we want to create access to opportunities in healthcare, in our community.
The decision to create a testing site really came out of a real live situation. So, Dr. Harmon, would you tell us a little bit about yourself and how you fit into this initiative?
So a few ways. So how did we get back to Macon, Georgia? So I'm from Macon, Georgia, born and raised in Lizella, went to school at Central High School, and then on to Atlanta to Spelman and Morehouse School of Medicine. And so I'm always in Macon. I know there's always a struggle as far as the disparities between the healthcare for those that have, those that don't have, and just those who don't even know that there's something out there to get. Anna called me. At that point, we probably had about maybe 4 or 5 employees here in Atlanta who thought they had potential COVID. They couldn't get tested. And then when Anna called, I was like, wait a minute. So a light bulb went off in my head. I said, you know what? We about to make this thing happen. And so I thought about, okay, we have Atlanta, we have Atlanta, we have Macon, we have the issue in Albany. So I said, you know what? Let's go to the central part of the state, create access, and just branch from there, because it's a central location and it's going to be a very large 7-day-a-week operation. Most of the operations in Atlanta, and I'm hoarse today, so I'm sorry. So most of the operations in Atlanta are what, on an 8 to 12?
12 o'clock, most sites are shut down because they run out of testing supplies. So a lot of our testing in the state of Georgia hasn't been about protocol, it's been about the supply chain.
And in the supply chain, so once we dug into it, that bright idea, right? Let's go open a site. You can't find swabs, you can't find a site, you have to have insurance, you have to have so many things to get tested. So what we decided to do was to join the it's called the HRSA program, which is the uninsured program covered by the government, which means that if you're uninsured, just come on. It's free. If you're insured, still just come on. It's free. But we want to create access for those people who are uninsured first, because the others have a means to get there. The uninsured folks, they can't even get tested. At this moment, I'm a pediatric ENT here in Atlanta, and I've got a 2-week-old in the hospital at this moment with COVID.
Wow.
And she's a little brown baby. So it is affecting our community in ways that people don't talk about, and in ways that we don't know about, because it's not always the important topic. But it goes from 2 weeks old to 102 years old. You need to know what your status is to protect the next person.
Talk about the mechanics of it. So now it's my understanding, and either one of you can respond to this, that it's going to be a drive-by testing site, just like a drive-in window. So talk about that.
So what we're doing, we will be located in West Macon at La Piata, the banquet hall, right off of Interstate Drive. We will have 3 large lanes. And so normally it's 1 lane. So we're doing 3 lanes. So our goal is to make sure that people can come in with an appointment. There will be some drive-ups without an appointment, but they'll come up with an appointment. They'll quickly get through that line, and they can get on back to work. They can get on back to a virtual homeschool, and it won't be a 3 or 4 hour deal. Because right now, because of the capacity, you may have an appointment at places, but you're going to sit in line for like 4 hours. And so we're trying to increase the capacity from 7 to 7, which means you can come before work, after work, and also the third shift people have a way to get tested too, because they go to work around that time. And so that's essentially what we're doing. You just drive in, you get tested, you register, you're done.
So once you drive in and you get tested, how long would that testing take?
It takes about 3 days to get your results back, and you get them electronically. So you'll log into a patient portal where you'll be able to see your results, and then our healthcare staff will reach back and go over your results with you and educate the patient about what the results are and any questions that they have to ask.
Okay, and then once you get those results, Dr. Harmon, what should you do? Should you go to the hospital, or just what should you do?
Yes, what we're also doing, so around that, so we'll have a portal that people will do the registration. In that registration, we can say, okay, I have questions, I want to speak to a provider, I want to see what I need to do, and we create a telemedicine visit. So there's a telemedicine option, there's just a testing only option, and if you're positive, we call you with a telemedicine visit so we can tell you where to go. Hey, you're positive, what are your symptoms? This is what you need to do next. These are places that you can go. You're uninsured, so this is the next step. So it's not like, oh, you're uninsured, hey, I have COVID, what do I do next? It's you're uninsured or insured, I have COVID. We're gonna walk through the CDC guidelines. We tell you what providers are in town that are able to take care of you. And if you're truly having symptoms, the provider will send you where you need to go, to the ER. So it depends on the severity of their symptoms as to the next step.
And on our website, they'll be able to do their intake, they'll do an initial screening, and then they'll be able to book and schedule their appointments. And then we'll have the telemedicine option, available for those patients that need to contact a physician or a nurse practitioner or speak to one of our healthcare professionals. And then we'll follow up with those same patients after diagnosis to provide guidance.
And if they're negative, you look it up on the portal, you're negative, and you go say, praise the Lord.
And with that, you still get like a little, guidance about if you have symptoms after, because some people could come in a window and you may test negative and then become symptomatic shortly thereafter. So you want to be just cognizant and aware of the symptoms. And some people are asymptomatic, but may have been exposed to people. So we're trying to make sure that we educate our community and make them aware of the signs and symptoms so that we don't continue the spread of this disease. One thing that we looked at, we have 777, so we're open from 7 to 7 days a week. So we're really trying to create access. Any day a week to come in and get tested. They won't get out their cars. We will come to the car. We will swab them. We also have a community education piece. We are offering jobs at the testing centers. We are offering training to get people certified as testers. And then there are other positions like logistics positions and local positions. We want to really empower the community to participate. And, you know, what COVID is doing, there's an economy behind COVID as well. Come in our communities, profit off of them. We're saying, no, let's help to enrich and empower the community and helping to assess the need and then educate each other on those needs in the community. So there's a lot of opportunities. When you visit our website, you'll see the different positions. They should be up by Monday. It'll take you to the Indeed applications to apply for those positions. And we're excited about this because this will help scale, this will create continual access. We're building an infrastructure because this is not going to go away anytime soon. And so we'll just have a continual resource that is community-based that will be able to serve the needs of the community as it relates to COVID.
So what I'm hearing you saying that this seems to be the objective or the mission is to go beyond just COVID and testing because, you know, this disparity is not applicable only, you know, the COVID. It's also, you know, across the board, across the gamut, as it relates to minorities being disproportionately affected in the area of healthcare and other areas. So talk a little bit more specifically about some peripheral, if you please, initiatives associated with what you all are doing.
So if you think about it, think about two scenarios, right? You have a mother who needs to go to work, and when she wants to go to work, just say she's symptomatic. She's heard from her friends that she can't get tested, but the rules at work are if you're symptomatic, you can't come back to work without a test. So that person's going to go to work and the whole job is going to be exposed to potentially COVID, right? But if you're able to get tested in a day, get your results in 2 days, that mom knows that she's only going to be away for 2 days. She's got enough paid time off for 2 days, but you don't have enough paid time off for, what'd you say, on a 26 days for the kids? So, right, so you don't have enough paid time off to stay off 26 days from your job. So it's also a way for people to get back to work without having to wait. And then the lab that we're partnering with, they said, oh, Anna, Paula, we got everybody. We can bring them down from North Carolina and New Jersey. We said, no. We've got people in Macon who aren't working. So we're going to get those people. There'll be shifts. They can work because they've been laid off because of COVID. So it's so many reasons that we want to expand, you know, education, so you won't take it home to grandma. Education, so you won't go back to work because you have an economic disparity, plus access so you can get back to work.
We have some technologies that we are offering, like corporations and government agencies. A lot of the agencies today are going to use technology for enforcement, where it's punitive and they're, fining people for, while they're doing this contact tracing. Well, for me and Paula, we were like, let's engage the community. Let's incentivize, staying in place. So we have technologies that corporations or government can use. When a person tests positive, they can actually participate voluntarily in this isolation tracking system that basically uses artificial intelligence to allow them to stay in place. And if the person follows those rules, if it's 10 days, in isolation, maybe they get a gift card, a $25 gift card or payment sent to them through our application. So there's a way to incentivize or encourage people to go retest to ensure that they're negative when they go back to their employment. The technology is constantly changing and constantly advancing. So there's a way that we can monitor this on a continuous basis where it's not punitive. Law enforcement agencies are being used to track people. It's just a misuse of a strategy that doesn't work when you're really trying to get behavior change in our community. When I was doing my PhD, I looked at immunity fallacy in minority communities. How do we change behaviors? Well, we believe it's never going to happen to us. We believe that we're immune to anything. We're not going to die if we don't wear our seatbelt. If the kid ain't in a car seat, they'll be fine. All of these things. And so to encourage behavior change, I think that a lot of times you have to incentivize that change. And so this is a way for corporate America and people to participate in spending less money in creating incentives Like we look at Tyson, 10,000 employees off work. That can't be good for your bottom line. Listen, if one of my employees don't come to work, I'm like, wait a minute, we missing somebody. So imagine 10,000 people not being there for something that we can manage, soft interventions, passive interventions, utilizing technologies that people can voluntarily participate in, and we just incentivize those tools to help encourage them.
The insured are going to be just as anxious as the uninsured to get tested because everybody wants to be. So how does that play out? Say if a person in fact is insured, because if the person is insured, I mean, do you get information from them so their insurance can pay? I mean, can
That's
you
right.
accept insurance?
Yes, we can. We absolutely can.
When they register, the intake process asks if they're insured or uninsured. If they say they're uninsured, it runs them through a clearinghouse, which will identify that they're insured or not insured. So you can't really lie to the system. So if you are insured and that insurance, maybe has a high copay, there may be other options for you to, pay a lower copay. We're exploring those options. We want to make this accessible. We want to remove the barriers for people getting tested. So this is not just for the uninsured in our Georgia locations. So for Georgia, this is about uninsured and the insured who do not have access. If you want to drive from Atlanta to get access to these tests, then you do, and you want to eat at a local restaurant in Macon while you're there, come on and help that economy start to move back up.
Right.
You really want to create some traction.
People are getting very excited. So, I mean, I want to know, and everybody else wants to know, when is this going to start, and talk a little bit more about the mechanics of it. And Anna, I really want you to talk about the website, because it seems that a lot of this information can be garnered through your website. But Paula, go ahead and talk about, you said you got 3 lanes, so talk about the mechanics of this thing.
Right. So we got the mechanics. And another thing is we'll also have people who aren't web friendly or internet friendly. There are also ways for them to sign up as well. So we have the very elderly who just don't understand the internet. We'll have a way for those folks to set up as well. So what we decided to do, Shannon, we said, okay, Anna, Anna's our professional. I'm laid back. So I said, we're about to party. I said, we're going to have the radios out there, food, we're going to turn up, and then Anna's going to do the professional line, keep everything going, but there's going to be a party once you get swabbed. You drive through, you get a little plate, you get on home. You see what I'm saying? Nobody has to get out.
Well, and then, what we need to do, we really do need to do a grand opening that morning so we need to talk about that.
That's right.
Just a little later on. So now, Anna, talk about a little more about how someone can really get the full gamut of the information, and also talk about, employment opportunities, because, there's a real need in this community for young people, and particularly African Americans to get employed and to be employed. And the good thing about it is that there are growth opportunities. Once you come into an organization, you might come in as somebody who direct traffic, but if you do a good job, I bet you Miss Anna's she's gonna be watching you.
At you. I'm looking at you. I'll move you up quick. I'll be like, you are now the director of everything.
Yeah. So before you know it, you could be a tester, a manager, a handler of the internet. So talk a little bit about the job opportunities and the website.
So at our primary company, Solutions Aid, we work to train up a workforce to create employment opportunities in many areas. So for Top Dog Solutions, partnership for us is always, like me and Paula said, when they said, hey, we're going to bring our folks, we like, you can bring them to get us started, but we're going to switch out because we got to bring in the local community members doing what they need to do for themselves. For us, the positions will be from traffic control, officers that can come in there, maybe some flagging positions. There'll be training for certified testers. The thing I like about the certified testing model is you may not just test at this local facility. We can train you to test and go into nursing homes for us to collect samples there. And this this will help us to really get into the community and create access in a way to testing that is non-traditional. It could be young people, but we're looking for folks that have medical backgrounds or that can shadow other people. So we're coming up with the whole process and rolling out. The initial positions that we'll be hiring for will be on saetopdog.com, SAE, topdog.com. That's the website. And we'll share some information with you about that. But on that website, if you're a church and you're interested in partnering, if you're in setting up a testing location, if you're interested in any of the jobs, you can go there and learn about it. You can go to the website to learn about COVID, and you can go to the website to learn about and book your appointments and do your intake and everything at that website.
Okay, give that website again, and we'll scroll it across the screen when we're running it.
SAEtopdog.com.
Well, this is Top Dog. Yeah, I remember that part, and that doesn't include Chihuahuas. But at any rate, this is a call to action.
A call to action.
I'm your host, Alex Havisham.
Call to action.
You had to get it in, didn't you, Paula? I have an interview Dr. Anna Everett, PhD, and Dr. Paula Harmon, MD. Both of whom are together, they're going to bring an exciting, necessary project and venture into Macon, which is going to be a testing site, so we can quickly learn whether we got COVID, and then we can also learn what to do if, in fact, we do have it. Stay tuned I want you to go to www.maconblackpages.com. And we'll have information because they say they're going to be open when?
Saturday, August 29th.
The 29th.
So we'll have some additional information on the website, and we'll be planning an event, a big event. And then you can come through and get tested and participate in the party and feel good that you know what's going to happen to you. And this can mean so much to the community because we all realize that's how it spreads, because people have it and don't know it. But when they find out, and if they know how to act, then that's going to make a phenomenal difference in our community. And as a citizen of this community, I want to thank you all for doing it. And I wish you Godspeed. And I want to let you know that any kind of way we can help you, feel free to do so. This is a call to action.
Call to
action.
Alex Havisham. Have a great day.
COVID-19 has impacted each one of us in different ways, but we've all been affected. The only way to protect Middle Georgia and each other is by working together and taking all preventative measures outlined by the CDC. Here's a few tips to prevent COVID-19. Wear a mask. Wash your hands frequently. When you cough, cover your mouth. Don't touch your eyes, nose, or mouth. Avoid contact with sick people. Also, clean and disinfect to keep you and your family safe.
We'll need your help, and this will help everybody get through COVID-19.
For updates on changes in Macon Bib, government services, and office hours, visit maconbib.us/COVID-19. And let's protect Middle Georgia.